Hello, dear friends. I'm Dr. Artem Park. If you have osteoarthritis of the interphalangeal joints, the metacarpophalangeal joints, if your hands hurt, if you feel clumsy in your hands, for example, things slip out of your grasp, if it's hard for you to hold something in your hands for a long time, if your fingers have trouble bending or straightening, especially in the mornings, I've noticed this in my patients. In addition, if you have swelling, any discomfort, or a feeling of heaviness in your hands. Friends, a regular ballpoint pen can help you get rid of these problems. Today, I'm going to show you how, in just 5 minutes, you can use this pen to restore your hands, increase mobility, reduce swelling, improve blood circulation in your hands, and eliminate things like pain, numbness, discomfort, or even that cold feeling in your hands that many people experience. Friends, please use this method and share this video with your loved ones so they can restore their hands too. In our hands, in our palms, there are 7 muscles called the interosseous muscles, and those are exactly what we need to work on. Please note that in the palm of our hand, we have metacarpal bones. Here, 1, 2, 3, 4, 5. 5 metacarpal bones. And between them, in the spaces between the metacarpals, we have muscles. 4 on the backside, 4 dorsal interosseous muscles, 1, 2, 3, 4, and 3 on the palmar side, 1, 2, 3. In these muscles, we need to eliminate trigger points, areas of local tension, and make them uniform and soft. Throughout our lives, we're constantly doing things with our hands, and the interosseous muscles are responsible for these movements, bringing the fingers together and spreading them apart. So whatever we're doing, whether we're writing, typing on a keyboard, holding something, washing dishes, or scrubbing with a cloth, these muscles get a lot of strain, and trigger points form there. Friends, if trigger points develop in these muscles, you'll feel localized pain right where they're located. Referred pain will definitely be present in the area of the interphalangeal joints. People feel as if their finger hurts, as if the joint itself is in pain. But in reality, the root cause is in these small muscles. In addition, these small muscles can compress tiny nerves that provide sensation in the fingers. People like this will complain about numbness in their hands. Numbness can occur when a person sits with their arms raised, when they're sleeping, or when their hand is in an awkward position, like when they're holding a phone. By working on these muscles, we can also eliminate these symptoms. If a muscle is affected by trigger points, if it's shortened, it can't fully contract, it becomes weaker, and a person may start to feel clumsy with their hands. So, for example, if someone's holding something, it might slip out of their hands or they might drop it. We can also successfully address this problem together using just a regular ballpoint pen. In addition to that, there are tiny blood vessels in our hands. They're called capillaries. If a muscle is tense, it compresses these blood vessels, blocking blood flow in the hands, and a person may constantly suffer from cold hands. This is especially noticeable at night when our heartbeat slows down during sleep, and as a result, there's already not enough blood flow, and now there's even less. Your hands get cold, and people even wake up because of it. And if the small veins are compressed, then accordingly, the venous outflow from the hands will also be disrupted. People may feel stiffness or like their hand is swollen up like a pillow. Swelling can occur, but it's temporary. That is, during the day, the swelling is less, but in the mornings or after sitting still for a while, the swelling can be worse. For example, some people can't take off their rings because their hands get so swollen. So friends, the problem with these interosseous muscles is actually very complex and causes a lot of different symptoms. That's why the exercises I'm going to show you today with a ballpoint pen are very helpful. Alright friends, let's get started with the exercises. The first step is to really warm up our hands and stimulate blood flow. To do this, we simply rub our hands together. Please set a timer for 1 minute. First, we rub our palms together, like this. After a while, you'll start to feel warmth. Then, with your warmed up palms, start rubbing the back of one hand, then the back of the other hand. Do this alternately for 1 minute as well. After that, make movements as if you're washing your hands. Really rub everything in well, friends, so the tissues warm up. A warmer muscle will respond much better to treatment, recovery, and self-massage. So 2 or 3 minutes is enough to properly prepare your hands. Now let's move on to self-massage using a ballpoint pen. Friends, we'll need the back side of the pen, which we'll use to knead our interosseous muscles. First, we need to work on the first interosseous muscle. Actually, it's more convenient to work on it with your fingers rather than the pen. Pinch it like this, pay attention to the front part, and make pulling movements away from yourself. It's almost painful, but still bearable. If your hand gets tired, you can shake it out or take a short break. Then continue working. In the center, we need to knead this area right here. Next, we need to use the thumb with some pressure to work on the area attached to the index finger. Just like this. Pay attention from the side. You can use circular motions, move side to side, or go back and forth. There's not much difference. The main thing is to apply deep targeted pressure. The range of motion's small. Next, you need to work on the area that transitions into the thumb. In the same way, I place my thumb and do these kneading movements. The first inner metacarpal space is the hardest to work on because it's the largest. The muscle here is bigger and more massive. For 1 minute, we knead this area. Then we move on to the other spaces. Here, you can actually feel the bone structure with your fingers. The second and third metacarpal bones, there's a groove between them. It's in this groove that we need to do the self-massage. Place your fingers there and move forward, back, forward, back. Do 7 to 10 movements, then shift over, friends, for 1 minute. Then move on to the next side. The exact same movements, the exact same duration. For 1 minute, knead the area between the middle and ring fingers, and then the space between the ring finger and pinky. Just like before, place your hand and move forward, back. If the pressure is too light, we won't get results because we won't be working the muscle properly. Too much pressure, that causes a reflex spasm or tension, also won't let us work the muscle deeply. We knead each muscle area for 1 minute, meaning each interosseous muscle on the back of the hand, a total of 4 minutes. Then we move on to the palm side. Friends, the palmar interosseous muscles, there are 3 of them, are also located between the metacarpal bones. You should use your fingers to find the bony structure. Here it is, the metacarpal bone. And here's the second metacarpal bone. So between the first and second, we have a muscle. We place it here, but instead of grabbing like this, we fix the hand with the thumb and index finger like this. Then we apply pressure and move forward, back, forward, back. For 1 minute, we knead the first palmar interosseous muscle, then shift over to the area between the middle and ring fingers. Same thing, press down, move forward and back for 1 minute. And do the same with the third palmar interosseous muscle. Also for 1 minute. In total, we knead our interosseous muscles for 7 minutes. Friends, on the palm side, there are usually fewer trigger points, and sometimes there aren't any at all. On the back of the hand, there are usually a lot of trigger points. After we've warmed up the muscles, rubbed them a bit, and stimulated blood flow, then we've kneaded them well and softened the trigger points, the muscles need to be warmed up. With heat, they relax even more, soften up, blood flow increases even further, and the capillaries open up. Friends, just take a regular hot water bottle, a rubber one, or an electric heating pad, wrap your hands around it like this, and hold it for 15 minutes. In fact, this kind of warming up will be enough. This greatly increases the effect of self-massage. After holding it for 15 minutes, our blood vessels open up even more, our hands get warmer, and the muscles are thoroughly heated. After that, please put on gloves or mittens and sit for another 15 minutes to keep your hands warm, so the heat doesn't escape too quickly. That's it. The routine's very simple. Please do it either every other day or 2 to 3 times a week. Dear friends, if my videos are helpful to you, if you want to support me and my team, please subscribe to the channel. I'll be very grateful to you for that. Please take care of yourselves and your loved ones. Send them this video if they have any problems with their hands. And stay healthy.